So today we are going to talk about arthritis pains, and this is a self-help guide to musculoskeletal pain. It is not a way for you to make your own diagnosis, but it is to allow you to take ownership of your body and the conditions that you might have, and know that we should not be passive users of the healthcare system, and we should be actively trying to help the doctor help us. So this talk is only about muscular aches and pains, so pains in the limbs. And today's talk will cover the causes of aches and pains, what your doctor would want to know, when to seek help without delay, and some general principles of managing muscular discomfort and what you can do to help yourself. So I don't think that any of you would have put your hands up and said that you have never had muscular aches or pains. Most people who come to these sorts of talks come here because they either have it or know someone who has it. And in fact, it is a huge problem. So muscular aches and pains constitute about 15% of emergency department visits, and 1 to 2 in 10 GP consults are because of musculoskeletal pain. There are very, very many more treated over the counter by pharmacists and physios, or most people just self-medicate and not necessarily go and see a doctor. So actually the problem can be very, very varied, and there can be a wide variety of causes. And a lot of what the problem might be depends on the context and the history. And so when you go and see a doctor with musculoskeletal problems, your doctor will actually be trying to determine what the problem actually is. So if, for example, you go and see your doctor and you say, "Doctor, I got a pain in my ankle." So what is actually going through the doctor's mind? Could it be a sprain? Could it be overuse? Can it be a bone problem? Is it posture? Is it arthritis? Is it skin problem? Nerve problem? Muscle problem? Or blood vessel problem? Or something else completely unrelated? But did you know that the average GP has 10 minutes to see, examine, and decide what's wrong with you and what to do next? So you have to help your doctor. What you tell your doctor is crucial to ensure that the most appropriate next steps are taken. So really, you have to keep calm. And how to help your doctor make the most of your consult? I have a list of tips here. These tips are not necessarily just related to joint aches and pains, but in fact, for any condition in which you're going to see your doctor, you need to, before you go, you should try and help your doctor out by thinking yourself about your symptoms, and ask yourself, when did this problem actually start? Did I ever have it before? And where did it affect me? What makes it better or worse? Or are there any other unusual symptoms that go together? Because as you saw on the previous slide, there are very, very, very many things that can all present with joint pains, but they may all be coming from different places. So when you are clear in your mind about what is going on, you will be able to give the doctor a better history. And if you think you may forget the sequence of events, please write it down, because it's really crucial to be clear and specific about the history of what happens, because diagnosis relies 80% on history and 20% on examination and tests. So here I have a picture of 3 birds. And, if somebody came and was describing a bird, an ostrich to me, for example, if you say, "Oh, it's a bird, it's got feathers," well, that applies to all 3, but you can see that there are things that differentiate the 3. And if you're clear and specific about it, then the doctor is more likely to be able to do the correct test and come to the correct diagnosis quicker. Also, when you go and see a doctor, please consider making a note of the following beforehand. Think about the illnesses and the operations that you've had in the past, and which doctors you see and where you see them. Especially if you see doctors in private practice and you've had things done in private practice. If you come to one private hospital, they will not necessarily have the records from a government restructured hospital, for example. So because there is no unified medical record system in Singapore, you as the patient needs to help the doctor along by keeping track of your illnesses and the operations and other things that you've had in the past. Also, try and figure out what medicines you are taking. If you're not sure of the name, then bring the bottles and boxes with you to your consultation or take pictures. If you have any allergies, note it down. If you're taking any supplements or herbs or TCM, please take pictures of the contents. Don't just take picture of the bottle itself, okay? I need to know the contents at the back, what it's actually made of. So people come and they say to me, but doctor, everything's in the computer, right? Well, not really. So government restructured hospitals and polyclinics do share a computer system, but we can only see test results and prescriptions. And that also only from about 2003 onwards. The National Healthcare Group clusters polyclinics and Tock Seng Hospital can view each other's electronic notes from about August 2016. There will be a new computer system coming in the middle of next year. So things may change again then. But the bottom line is this: if you go and see a private GP or private hospital or private clinic, they can't see information from government restructured hospitals or polyclinics and vice versa. Okay, so try and help your doctor out. Now, let's get to the meat of the talk. So this talk was entitled Treatment of Arthritis Pains. But before we embark down that road, I was going to talk a little bit about some common causes and some rarer causes of aches and pains in muscles and joints. I'll spend a lot more time on the common causes, and the less common conditions that I've listed on here, on this slide here, like gout and immune-related conditions, they are talks in themselves. So we will not have time to cover that today. Let's talk about overuse injury. So believe it or not, overuse injury makes up 50% of musculoskeletal problems, and that can be overuse in because of stress on bones or muscles or tendons or ligaments. And when you repeatedly stress that area, the structure can become inflamed and painful and later on weaken. So one example is hammering that causes tennis elbow, or in my case, I gave myself a trigger finger when I decided that I would scrape off the wallpaper for my living room all entirely by hand. And 3 days of scraping later, I found I couldn't straighten my middle finger. March fractures are stress fractures of bones in the feet for people who've decided that they're going to do like round the island walk, perhaps. So the discomfort from an overuse injury is usually localized to the area of injury. So for example, this image here of a person carrying a tennis racket is pressing on the outer side of his elbow, and he's got tennis elbow. So overuse injuries can occur anywhere, shoulder, wrist, elbow, anywhere really. So that's the first sort of thing that can give you aches and pains. Now, poor posture is the second thing. And poor posture can contribute towards neck and back pain. So have a look at these two men. They have this sort of question mark kind of posture where the head is like pushed forward and the shoulders bulging out. At the back, hunched over their desktops and their laptops. And this spells disaster in the long term. Why does it do so? Well, it's because our head is really quite heavy and is supported by, it's a little bit like a golf ball on a golf tee. And when you have a golf ball on a golf tee like this, straight down, like in the first picture, under normal posture, all the weight of the head goes down through the spine And the spine is in fact bones that are stacked one on top of the other, held together by ligaments and muscles like ropes that are holding it together. In between each level of this bones, there are discs, and the discs act as shock absorbers, because if not, the bone is rigid. And if you don't have a shock absorber, if you were to jump, that force that goes through the rigid bone will cause it to fracture. So your bone, it has to be bone disc to allow you to move around and to jump and to run. The impact will be absorbed by those shock absorbers. The ligaments that hold the spine together keep it rigid, stable, but flexible. Yeah, it's like ropes that hold it together and keeps it flexible. So when you bend your head forward like this, like I'm doing now, so for every couple of inches forward that you push your head, the amount of pressure that goes through those discs and those joints in your neck and the upper part of your spine increases, because it's a little bit like having a golf ball like this, and you are moving the golf ball forward, and the muscles of your neck and the rest of your spine are pulling back on your head to try and stop it from falling off the tee. So what is the consequence of spending most of your time looking like this? Well, the forward head, rounded shoulders puts a great deal of stress on the lower neck bones, and the increased shear stress will contribute towards degeneration of the joints in the neck in time. So here on the right-hand side, I show you my own MRI taken a few days ago because I've had neck pain and numbness in my right arm. And lo and behold, it doesn't take a doctor to tell you that something is not right over here. And what's essentially happened, if you look at the bottom here, everything is lovely and straight. So this is bone, disc, and these at the back here, this black, like looking like a road that's coming down here, that's your nerves traveling down in the spinal cord, or rather my nerves traveling down in the spinal cord. The white stuff around the side is the fluid that goes round. So if you have a look here, at this level, I have this bit that is poking out, okay? What has happened? Well, I have spent a lot of my time with my laptop, poking my head forward like that, and my disc, after years and years and 40 over years of doing that, has got fed up and is starting to poke out towards the spinal cord, and is compressing one of the nerves, giving me numbness and pain in my arm. So for those of you who have younger children, please make sure that they don't spend all their times hunched over their laptops and their devices, because when they get to my age, they will also have this problem. And in fact, there's already an epidemic unleashed upon us. This article was from 2013, and it says, do you suffer from eye posture? So how tablets and smartphones are causing an epidemic of neck and back pain as people hunch over devices. So what is poor posture? So poor posture is this forward head, flat back, posture where your head is like the golf ball that is forward on the tee. Good posture is balanced and upright with the shoulders pushed back. If you have weak abdominal muscles, you are unable to pull yourself upright and straighten your spine, and so your head also takes a forward posture. So you only have to stand and watch people waiting in the queue to see that many of us, especially if we are overweight, we have weak abdominal muscles and we stand like this, and therefore will have neck and back problems. For the ladies who like to wear very, very high heels, when you wear high heels, in order for you to keep upright and to prevent you from falling forward onto your face, you have to arch your back. You have to increase this arch in your back and increase the arch in the spine in order to remain upright. In order to do that, when you arch your spine, you put more pressure on certain discs, particularly the discs of the lower back. And when you sit, how your sitting posture is also affects the pressure in the discs. So if you slouch forward like this, that puts a lot of pressure on the lower back as well. So if coupled with age, when we get older, the capacity of the body for renewal of cells goes down. So the rate of making new cells and repair goes down. So if you subject your body to lots and lots of insults and a lot of stresses, physical stresses and pressure in different areas, the wear and tear will outstrip your body's capacity for repair, and therefore we have a situation where we have degeneration and loss of cartilage. So here's a picture of a knee showing how healthy cartilage looks like and what happens in wear and tear or osteoarthritis or degenerative arthritis. You can see that when you have wear and tear, it's not that, you know, when you go and see the doctor and the doctor says, oh, it's just wear and tear, your cartilage is getting thin. So people imagine that it's uniform thinning. Actually, it's not. It's like a road that starts to have potholes and cobbles, you know, you start getting like a cobblestoning kind of effect, like in this picture. And so with cracks and fissures in the cartilage and areas where the bone is exposed. So some patients would say to me, oh, you know, I can hear the crack, crack, crack when that noise when I bend and stretch my knee. Why is that? It's because when the cartilage starts to degenerate and it becomes uneven, then you have two uneven surfaces that are rubbing one on another. And when you have this uneven surfaces rubbing one on another, you get that those crackling noises because of that. So that's what happens in the knee. So if we look here on the right, this is actually a schematic diagram, a picture of the lower part of the spine. So like what I explained earlier on, you have bone. This is bone, and these silvery bits in the middle are disc. So this is disc, and these are the nerves that come out from the spinal cord that travel behind. And over here in the lower part of the spine, there are nerves that come off the spinal cord up here and they come out here. And when the disc starts to degenerate, it stops looking plump. So if you imagine that when we are young, that disc is a little bit like a cushion, and the cushion is nice and plump and, you know, the very supportive foam. As we get older, like an older cushion or an older mattress, it stops being nice and plump and it starts to sag. So when it starts to sag outwards, it then pushes on the nerve over here. And because it is giving less support, the bone on either side tries to grow outwards in order to increase the surface area to reduce the pressure that is felt by the pressure sensing nerves. So what then happens is that you get all these bony spurs, or Chinese call them 骨刺, that form over here. Where's my cursor gone? They're here and here. And it's well and good if you've got bony spurs, but if you've got bony spurs that travel near nerves, like what you saw on my MRI, they then grow out this way, and in certain positions of my neck, I turn one way and I can feel tingling in my hand. And that's because this bony spur, as I turn, has got near enough to irritate that nerve. So that's degeneration gone through. The other thing that can cause aches and pains in this part of the world, believe it or not, is vitamin D deficiency. So vitamin D, everybody knows, is the sunshine vitamin, but more than 70% of Singaporeans are deficient in it. Why? Because we leave for work at 6 a.m. and we get home at 8 p.m. and we probably had like a short dash to the kopitiam for lunch, and we don't go out into the sun because sun is photo aging. So we stay under cover all the time, and therefore are deficient. And at weekends, it's spent catching up on housework, so you never ever go out and never see the sun. And why is vitamin D important? Vitamin D is important for bone health and muscle health, and it's increasingly recognized to be playing a role in many other areas of the body, including the health of the immune system. If you are vitamin D deficient, you can feel achy everywhere, and it tends to be the ache at the end of long bones, so the ends of your arms, end of your thigh bone, and also you may be weak in your muscles because of that. So those are the sort of non-life-threatening conditions and non-organ threatening conditions that I've talked about that cause muscular aches and pains. But this bit is in red because it's really important that you should seek medical advice without delay if you have increasing severity of pain. Pain so bad that you can't sleep. Pain so bad that you can't move. If you have fever with the pain or weight loss with the pain, if you have numbness or weakness in your arms or legs, if you lost control of your urine or your bowels, or you cannot pass urine or cannot open your bowels, you need to seek medical advice. If you find that your joints swell up and they feel really hot, very red, very stiff, especially in the mornings, if it takes you 1 to 2 hours to move around little bit by little bit to loosen up, you need to seek medical advice without delay. If you have other symptoms that come on with the joint pains, for example, if you have rashes, if you have breathlessness, this is likely to be joint pains in association with some other sort of condition that needs treatment. So if you have any other strange symptoms that come on at the same time or very close to the time of the joint pains, please do go and see a doctor if it is anything on this list at all. So what can you do to help yourself? The most important thing is to educate yourself, and educate yourself with reliable sources of information. How to filter out reliable health information is an entire talk on its own, but there is a very, very useful tutorial given by the National Institutes of Health in the US, and this is the URL. They have a tutorial for lay people on there to teach you on how to evaluate health information that you see on the internet, because many people come and they will say, oh yes, I read this, but how do I know that it can be trusted? So this particular website teaches you how to sort the wheat from the chaff, which is what this picture is all about. The other reliable site that you can go to for health information locally is our Health Promotion Board's website, which is listed up here. So we'll go through it from the beginning again. So overuse injury. I talked about overusing particular parts of the body. For example, Chinese New Year is coming and I decided that I want to clean all the windows, and therefore there I am with my arm up and down, and the next day I can't lift my arm. So what can I do? Well, initially avoid the activity that aggravates it. So you know, if you're going to, if you have shoulder pain, please don't be doing like this lady is doing here, making it worse by, you know, putting more weight on the painful shoulder. Do rest it. If you find that using ice packs or warm packs helps, then please do so. Some people say to me, which is better, ice pack or warm pack? And I said, which one works better for you? So it is really which one works better for you. If you find that using an ice pack for a while helps the pain, then please do so. If you find that using a warm pack helps, then please do so. Okay, because all of these are just means of reducing the symptoms. There are other pain relieving methods that can be used if needed. Some people find that gentle massage can help. Some people find that going for acupuncture can help. Some people will take painkillers. Other people will just leave it on its own and then it will get better by itself. But stretching and strengthening exercises to minimize the chance of that overuse happening again can be gradually restarted as things improve. It is very important for us to remember to protect our joints and our muscles. So you can find a different way to do the same thing. So, you know, if you're stressing out with jars, then get a jar opener, a device that lets the vacuum out the jar so that it's easier for you to open it. If you can't turn those can openers, then get a battery operated can opener. You know, washing clothes by hand. Here is a very, very old illustration that I picked up from a museum website, and it shows, you know, what women had to go through previously, wringing everything by hand, and, you know, what a revolution it was to have this clothes wringer. So, you know, these days we have washing machines. So, you know, that may be some way that you might choose to do things. You know, instead of carrying everything by hand, consider investing in a trolley. So there are usually different ways that you can employ to do the same thing. Exercise is really important, and exercise, regular, moderate, load-bearing exercise. So to keep your muscles and joints healthy, walk. And when I say walk, I mean walk like this, not walk like this, okay? Don't walk like this, because if you carry on walking like this, you will end up with a neck that is worse than mine. I don't walk like this, okay? Yeah, so don't do that. Regular moderate load-bearing exercise can be also things like yoga and Tai Chi. In fact, yoga and Tai Chi in all the guidelines for management of wear and tear arthritis throughout the world, the Americans, the Europeans, and us, yoga and Tai Chi are two activities that are within those guidelines as being important and beneficial for muscle strengthening and balancing to help with wear and tear arthritis of the knee and of the hips and spine. So this picture, does anybody know where this is? This is Bishan Park. So Bishan Park, at the weekends, there is a Tai Chi class run by one of my colleagues from NUH. So, you know, exercising gentle. Tai Chi looks deceptively gentle, but yeah, the times that I tried going for a Tai Chi course in university, and I never sweated so much than when I did that. So, but don't overdo it when you first start. Remember to warm up and warm down. The reasons for warming up and warming down are that you need to prepare your muscles and joints for activity, for intense physical activity. Because as we get older, I told you the capacity for repair goes down, yes? And you need to sort of pre-stretch the muscles to let them, to increase the blood flow to that area so that they are ready for activity. Otherwise, you will do yourself an injury. Weight management is really important, and being conscious of your weight, losing weight if you're overweight, so that there is less stress on the lower limb joints. So on the right hand side here is a picture, is a diagram of what happens as we, if we have what we call truncal obesity. So if we carry more, weight around our middle, you can see that in fact, what has happened between the first picture and the last picture here is that this person here has had to arch their back more, because when you carry a lot of weight around your middle, it's a little bit like in pregnancy, women have to arch their back backwards to keep themselves upright. And that act of arching the back forward, the back backwards, puts a lot of stress on the joints at the bottom of the spine. And so will cause accelerated stress and on these shear stress on these discs. And over a period of long period of time, like years, will increase wear and tear there. So the other thing is that in fact, it's not just about the load. So now we also understand that people who are overweight can develop wear and tear in joints that are not bearing weight. Isn't that interesting? It's not just, so if you are very overweight, your wear and tear isn't only happening in your lower back, your hips, your knees, ankles, and feet. It's also happening faster in your neck, in your hands, and other places like that. Why? Because when you are overweight, you have more fat. And fat produces chemicals. So fat is not just a storage organ. Fat is actually an organ that produces chemicals that drive inflammation and speed up cartilage breakdown. The other aspect that people are often not aware of is sugar. And sugar looks harmless, but is actually a time bomb and an inflammation bomb. So women are allowed 24 grams of sugar a day and men 36 grams. That means nothing to you, I know. But 24 grams, if you imagine that 1 teaspoonful of sugar or 1 cube of sugar is 4 grams. So you're allowed 6 teaspoonfuls if you're a woman, and 9 teaspoonfuls if you're a man. And anything more than that will do all kinds of things to you. So it ages the skin, it damages the, it stresses out your pancreas, it makes you put on weight, it lets you accumulate fat in your liver, it inflames the lining of your blood vessels, it can make you very dependent on sugary foods even further and make you very, very low in mood if you don't have sugar. It drives inflammation, it can wear out your joints faster. So really, if you are diabetic or if you've been told that you are borderline diabetic, and you have to do everything you possibly can to control your blood sugar if you already have muscular aches and pains as well. Because if you don't, you are going to wear out, your joints are going to wear out faster than somebody else of a similar sort of age. So it speeds up that wear and tear process. And sugar also affects muscles and it affects nerves as well. It affects your eyes. It can affect all kinds of places. So this is a slide that usually gets people gasping in horror because if you imagine that 1 teaspoon of sugar is about 4 grams, then if you go to kopitiam and you say, "Uncle, I want 1 cup of kopi," as it comes, what it will be coffee, condensed milk, and 1 spoon of sugar, which equates to be about 15 grams, so 4 spoons of sugar in that cup. And if you are a Gong Cha fan with lots of loving your bubble tea, then the pearls are full of sugar and you may average 45 to 55 grams of sugar per cup. It's enough to make you feel unwell, just thinking about it. So popular drinks, well, what about Coca-Cola? So one little red can of Coke has 9 teaspoons of sugar. Orange juice is not better either. As you can see there, you know, you go to McDonald's and you say, oh, I won't have Coke, I will have Minute Maid instead. And lo and behold, look at the Minute Maid and the stack of sugar by the side. And at the bottom right-hand corner here is vitamin water, which is really, I would use your money more wisely and not spend it on vitamin water, which is basically color and vitamin C added as an antioxidant to maintain the color. It's got nothing to do with vitamin at all, okay? Plain water from the tap is fine. And then look over here, a milkshake. I mean, look at that. You know, so the content of sugar in popular drinks is quite scary when you think about it. So usually when patients come to me, I never ask them about their food. I will always ask them about their drinks. And what is the biggest culprit this part of the world? It's 3-in-1. So we love our convenience drinks. And in this part of the world, convenience drinks is 3-in-1. 3-in-1 coffee, 3-in-1 tea. I'm not saying 3-in-1 isn't lovely. 3-in-1 is truly lovely. But what's also lovely is the sugar content per packet. Do consider, when you've seen this, do consider if you are finding it really hard to lose weight, if you're wondering why your sugar's not controlled, look at your beverages. My challenge to my patients is, can you kosong everything? Can you not take sugar in any of your beverages? And usually I'm greeted with a look of horror. They're like, what? Yes, I did like 3-in-1 once upon a time, but since I started doing this series of talks and had the awareness of the sugar content, I've invested in one of these. So one of these means that I can have my plain old Nescafe with milk powder carried around, no sugar, and I'm not tempted to go to buy anything that's not healthy for me. So please consider making conscious dietary choices. So this is a diagram of the healthy plate that comes from the Health Promotion Board's website. I would urge you all to go and have a little look at it because it's a treasure trove of useful information about what you can do in terms of helping you achieve a better balance and better more conscious dietary choice for health. You can also make your smartphone work for you. So if you haven't got this app already, I highly recommend it. It's again, from Health Promotion Board. It's called Health Hub. And what's wonderful about it is not just the information, but the fact that you can see your own health record. So you can see what appointments you have in the polyclinic, what appointments you have in restructured hospitals, what blood tests you've had done. You can't see the x-rays, you can see your children's immunization records and everything on there. So it's a wonderful resource, and certain institutions even allow you to book appointments through Health Hub. So what else can you do to try and improve the aches and pains? Sleep is really critical. When we don't sleep enough, pain signals are amplified by the brain. So the pain that you feel out here in the arm or the leg is because of nerve endings that go and go to a particular part of your brain and is interpreted as being discomfort in that area. But these signals are turned up. So it's a little bit like someone turning up the radio when you don't sleep enough. So, and when you have mental stress or you are unwell, so physical stress, let's say you have flu or cough or cold, all the aches and pains will worsen because of inflammatory chemicals that are being produced, as well as the lack of rest and therefore the amplification of the pain signaling. What's even more interesting is that if you don't sleep well, you can't lose weight. When you don't sleep well, your body produces certain types of stress hormones, which are linked to weight gain, which then will put more stress on your joints, which will then make the pain worse. So you see where I'm going, right? You end up going round and round and round and round. So finding a way to get restful sleep is critical to trying to break the vicious circle that some people get themselves into when they have aches and pains. There are many, many other methods for relieving pain. So here is a list of them. You can use hot and cold packs, like what I mentioned earlier on, warm baths, massage, acupuncture, gentle exercise, mindfulness, meditation, hypnosis, aromatherapy. Some people engage in distraction therapy, using supports, braces for the knee, for example, inserts for the shoe, walking with a cane or a walking stick, and using pain medication are some ways that you could employ if you had musculoskeletal aches and pains. So pain control medication can be taken by mouth, can be given in the form of gel to rub on, or patches onto the skin, or injections into the muscles or joints. Or there are other special pain control methods if your pain are very, very severe. For simple aches and pains, if you have no allergies, simple medications like paracetamol or Ponstan will be more than enough. Pain is a little bit like fire. Many people say to me, oh, I didn't take the painkiller. Oh, why didn't you take the painkiller? Because I just want to tahan and I want to bear with it because I'm just fighting it and I'm not letting it get the better of me. Well, yes, provided you have other means of reducing the pain, but if you've tried everything else and you really need the painkillers, don't wait for it to become really bad before doing something about it. So for some people, the strategy may be take it regularly initially to get the volume down and then reduce it and use other methods to maintain it at a lower level, which is how you would the strategy that you would use to control a fire. If a fire is very big, you're not going to say, oh, let me just use this little bucket of water forever to keep it small. You won't get on top of it. So if it is a big fire, I need the fire engine. When the fire is small, maybe my little bucket of water occasionally will then manage to keep it small. Okay, so many people do not like taking pain control medicines because they feel, oh, I don't want to become dependent on it. But you have to think of it in terms of there's a balance of risk versus benefit. And if you are in such a lot of pain that you cannot function, you cannot interact with your friends or family, you can't go out, all because you do not want to take 2 Panadol and you can't sleep, then that is definitely you need to rethink your risk versus benefit assessment. For people who have been diagnosed with conditions that cause joint inflammation, such as rheumatoid arthritis, please understand that the reason why you have pains in the aches in the joints is because your joints are inflamed. Your joints are inflamed because your body is attacking the joint. These are only for this slide is meant for people who have inflammation, autoimmune inflammation in the joints. So these people don't have wear and tear. They have an illness where the body's immune system has gone haywire. It thinks that the joints are the enemy and it's attacking and attacking and attacking the joint. And the medications that your doctor gives you is to try to stop that attack. The reasons why they want to stop that attack is to prevent irreversible damage to your joint. Because again, the fire analogy is useful here. The attack is like a war or a fire in a house. And if you do nothing to put out the fire, then the fire will eventually engulf the house and destroy the structure of the house. So the X-ray at the bottom there is of the hand of a lady who's had rheumatoid arthritis for a very long time. And you can see that it's supposed to be taken with the fingers outstretched, but she's unable to straighten the fingers. So the fingers are kind of like this, fixed in this position, and there are holes in her bones over here and here, here and here, here and here, where the fire has actually destroyed both the bone as well as the underlying cartilage. So these days, it doesn't have to be like this. We have very, very good medications that can put the fire out or keep the fire really small. And we also know that if you treat the fire initially aggressively, you have a chance of putting it out. So for patients who have rheumatoid arthritis or other autoimmune illnesses, please educate yourself about your illness. Look after yourself. Take an active role in the management of your condition. Learn about it from reputable sources so that you can have a discussion with your doctor about what medicine is best for you, because there are very, very many medicines these days, and this is going to be a thing of the past. So other lifestyle factors that I must emphasize here are to stop smoking and moderate alcohol. So, you know, everybody, if you ask smokers, oh, you know, what is it that, what is bad about smoking? They will all say to you, oh, the doctor tells me I can get lung cancer. And my comeback will be, lung cancer is the least of my worries for you. Smokers have faster degeneration in the joints. Smokers have increased risk of autoimmune illness. Smokers with autoimmune illnesses need more medications because their diseases, their conditions will be less responsive to the medications that we usually give. And they have an increased risk of heart attack and strokes. So if you already have wear and tear, or even if you don't have wear and tear, if you have an immune illness, or even if you don't have an immune illness, I would urge you, if you are a smoker, to consider stopping smoking. Patients come to me and they say, doctor, I'm not scared of dying. 医生我不怕死. And I say to them, yes, I also am not scared of dying, but it's the road on the way to dying that I'm scared of for you, okay? Because we are not also lucky to just drop dead. Yeah, many people languish with immune illnesses that slowly eat away at their bodies and cause them endless amounts of suffering. Stop smoking. Okay. Moderate alcohol. Alcohol intake can worsen certain conditions like gout, and long-term consumption of alcohol can reduce your bone density, increase the degeneration, and increase your cancer risk. So really, these two lifestyle factors, look at it and take a reality check. But doctor, I take a supplement, can? Yeah, well, depends on the situation and the supplement. So, you know, if you had shoulder pain from cleaning the windows, that's not going to respond to your supplement. Okay. If you have pain because you're not sitting properly, you're hunched over your device like this, that's not going to respond to supplements. What will help is a change in your activity and change in your posture. Okay. And also the other thing to say is that very few complementary supplement medications have actually been shown to have good quality evidence to support their use in the degenerative arthritis. And in rarer types of arthritis, like the rheumatoid arthritis that I talked about earlier on, it's essential to treat it early and aggressively. So I would put the supplements on the back burner because no supplements have been proven to be as good as the medications that we give to treat it early and aggressively. Please be careful. If anyone tells you that a herb or complementary therapy has no side effects, it's not likely to have any beneficial effect either, okay? The law of nature, the yin and yang, is that there's no such thing, that there's nothing in this world that has only bad or only good. Nothing. If it sounds too good to be true, it probably is. Quick fixes like this fast food is rarely effective, yeah, and rarely beneficial. Okay. Another word of caution, all natural. So when you go and look at supplements, they will there are all these taglines for complementary medicines and supplements. It's all natural. All natural doesn't mean all good. There are lots of poisons in nature. Okay, the Aboriginal people, those they use blow darts to kill animals. Those blow darts, the poison come from where? Natural ma, still poison, right? Yeah, tobacco also natural. What? Do you recognize this plant? This is Cheko manis or mani cai, Sabah vegetable. Why do I put it up here? A lot of people eat it. If you eat it raw, you have an increased risk of developing lung inflammation and having your lungs damaged. Okay, that happened in Taiwan some years ago. So, caution, this is all natural. Doesn't mean it's all good. More of a good thing, not necessarily better for you. Okay, look at this picture. The top one is of a desert. No water. Very bad. The bottom one, too much water. Very bad also. Yeah. So what I'm trying to say to you all is that balance is always the key. Be it for water. If you drink too much water, what will happen to you? Your salt levels in the blood will go very low. You will have fits and you will die. If you drink too little water, you get dehydrated, your kidneys will fail and you die. Yeah. Vegetables. You eat too much vegetables. There is a condition where that is seen around Chinese New Year time, where people who don't usually eat vegetables eat a lot of the yeast, the losangs, and then it gets stuck in their intestines, and they end up having surgery for that. Okay, you eat too few vegetables, that's also harmful. Eat too much calcium, it's bad for you. You get kidney stones. Too little calcium, bad for you. Exercise, vitamin C, too little vitamin C, you get bruises and scurvy. Too much vitamin C, you get kidney stones. Anything is always a balance. So what I'm trying to say is that there is nothing in this world that is absolutely good or absolutely bad. And the same is true of medications. So those people that think, oh, I take more of this because my doctor said that I have osteoporosis and I must take more calcium. So they take calcium tablets, they take Ensure, they take Enlin, they take lots and lots and lots and lots, and then they come back and the calcium is really high and they got stones in the kidney. Okay, so try to remember that the key to life in general is balance. More expensive doesn't equal more effective. Okay, though there are studies done to show that if you tell people that this medication is really, really, really expensive, the placebo effect is more. That has been proven, okay, that they feel it's more effective because they paid such a lot of money for it. There's a myth also that, I take Chinese medicine, so I will take it 2 hours away from my Western medicine, so everything is fine. Well, yes, but all medicines, if they have an effect on your body, come out two ways. They either come out from your liver or they come out from your kidney. And if you take your medicine 2 hours away from your Western pill, there's no guarantee that there's not going to be any drug interaction. All that there is that it won't mix in your stomach. But what if your Western pill is one that you take once a day and it lasts 24 hours? So then you take your Chinese medicine, then it interacts, then how? Right? So, you know, if you, this 2 hours apart thing is an absolute myth, okay? Also, beware unregulated powders and capsules bought from the internet and from neighboring countries. You can see that this is a real pet topic of mine, right? Because so many people come to me with these sorts of questions, and I've seen so many people with so many problems that I feel that I really have to get this message across every single time. Because powders and capsules bought from the internet may contain banned substances. They can have things that can affect your liver, your kidney, can cause severe allergies. So if you decide that you want to take something, please be upfront with your doctor and say, doctor, I want to try this. Tell them what complementary herbs you're taking because of the risk of interactions. There are all kinds of popular supplements like vitamin D, for instance. Okay, so vitamin D supplements actually, if you are deficient in vitamin D, has been shown to help your aches and pains. Only if you are deficient, okay? Too much vitamin D is bad for your liver. Yeah, balance again. Yes. So you might consider going out and taking a walk out in the sunshine, or supplementing yourself with food, or taking a supplement if you're unable to do either of those, as some patients are not able to take these things, or they're not allowed to go into the sun because of certain illnesses. Fish oil. Recently, guidelines have come out, and more information has come to light to show that, in fact, there is very little evidence that it works in wear and tear, osteoarthritis. So the latest guidelines for osteoarthritis do not recommend fish oil any longer. In conditions with inflammation, like rheumatoid arthritis, it may reduce the pain and reliance on painkillers a little bit, but it has to be taken in a high dose for a considerable period of time. And in case you're thinking of doing so, I would urge caution if you are on blood thinning drugs like aspirin or warfarin, because dosage higher than 3 grams a day will interfere with your blood thinning drugs and increase your risk of bleeding. And fish oils coming from fish in the sea, there are mercury and other impurities because the sea is really dirty. The cheaper brands of fish oil may not filter out these impurities. So this is another favorite supplement, glucosamine and chondroitin. So glucosamine and chondroitin are extracts from shells, and 2 large studies have shown that a small proportion of people with degenerative arthritis in the knee, only in the knee, if you take glucosamine, may reduce the pain and may improve your function, but does nothing for the X-ray appearance. The X-ray look exactly the same, but these people say, hey, I feel better, okay? What is the size of the effect? It's as good as Panadol, okay? It may worsen glaucoma, may raise your blood sugar, may upset your stomach. More recently, studies with chondroitin has been shown that it can help, again, the pain in your hand osteoarthritis, but only the hand, not the knee or the hip. But what is slightly worrying is that in, I think, 2018, there was reports that chondroitin, tests for chondroitin in certain cell studies of cells in the Petri dishes showed that there was an increased risk of cancer in certain types of cell lines if those cells were given chondroitin. So I would urge caution and ask people to consider very carefully. Of course, we don't know whether this will translate into increased risk of cancer in a human, because this one was in cells, but I would urge people to ask yourselves, if you are taking supplements, why am I taking it? Does it really help me? Or is it, is it putting a hole in my pocket for no benefit? Yeah. And this is another slightly worrying article. This was from before, it was 2015. This was from America and the New York State Attorney General's office. 4 major retailers, GNC, Target, Walgreens, and Walmart, found that 4 out of 5 of the products did not contain whatever herbs they said on their labels. So, they would tout all kinds of things, medicinal herbs, but actually they were things like powdered rice, asparagus, houseplants. So terrible, right? Okay, so just so that you are aware that it's not always what it says on the tin, because the regulation of the supplement market is very different from the regulations of conventional medications. So that's enough nagging from me. I just want to go back and remind you all that, in fact, many muscular aches and pains, like the pains that we have across here, can be improved with self-management, change in lifestyle and habits. So today I'm sat here and Angie has very kindly put the laptop at eye level for me so that I don't have to bend my head and stress out my degenerate neck joints. So there are some things that will be chronic. So for example, that 骨刺 in my neck will never go away unless I ask my surgical colleague to trim it for me. So learning how to manage the symptoms, the numbness in this hand, for example, is crucial, as is learning to adjust to the presence of those symptoms. So if you had any of those red flags that I mentioned earlier on, the thing that said, you know, please do go see your doctor if you have these things, please do go and see your doctor. If you are in doubt at all, do go and consult your doctor. But make a list before you go, because you have 10 minutes. Okay, so that has concluded my presentation, and I am going to just see what sorts of questions you guys have put into the chat box. Specific sports that are more injury prone. It depends on the person and the sport. So for example, I do not go trampolining because I have a bad neck. I would not go bungee jumping because I have a bad neck. I don't go, in fact, I don't even go on roller coasters because I have a bad neck. You know, there are most sports, there are right ways and wrong ways of doing things. And any sport, because you are putting, the nature of the sport is such that there will be a degree of stress on those joints anyway. So for example, you know, if you're a volleyball player in your youth, as you get older, these joints here will wear out because of years of playing volleyball. If you have done karate or taekwondo in your youth, then you know your knee and hip might wear out, but does not mean that when you are young and are able to regenerate faster than you are wearing out, then you know, it's very hard to say don't do any sport, because you know, then nobody will do anything, right? So you, I would say that if you know that you have a problem in a particular area, then don't do that. Someone says, at 60 with years of sedentary lifestyle, seems like my right thumb's mild numbness may be from the degenerative disc disease, neck rather than carpal tunnel. Any comments? I can't comment because I haven't examined you. And really, if you want to know, then you would have to go and see somebody and they would do the tests to look at both of them, because it can be very difficult to tell. Is honey as bad as sugar? Honey is also a for, oh, I didn't have a slide that I did on another talk that I'd done, where actually honey is mostly fructose, and if you are taking honey, is a fructose, if taken in a supra-nutritional way, will get shunted to the liver and cause fatty liver. So for example, fruit juices in themselves are not bad, only if you just drink fruit juice and don't eat anything. Then the fructose will be broken down. But if you already ate a full meal and that juice then gets drunk, it's drunk over and above your nutritional requirement already. Yeah, the energy is surplus to what you need and will be shunted. So the same with honey and all other forms of sugar as well. Sugar in fruit like mango, bad. Well, natural sugar, yes, our sugar is also cane sugar. It's also natural. It either comes from cane or beet. That's also natural sugar. So sugar is sugar is sugar. Don't care whether it is gula melaka or organic sugar or brown sugar or molasses. It's all sugar. So if you eat too many mangoes, you will get fatty liver too. Let me see. Kiefern Tech plaster is good to relieve pain. So someone's asking about a plaster with a painkiller built in. Is it okay to use it regularly? Maximal 2 pieces a day. Maximum 2 pieces a day is the recommended dose, yes. The muscular plaster contains a slightly different medicine inside. So it doesn't contain, Kefentech contains a particular kind of drug. For 85-year-old diabetic dementia and wheelchair-bound patient with severe joint pains, help to relieve the pain. Reliable creams, it depends on her underlying health condition and what other underlying problems that she may have. So this is something that should be discussed with her doctor, whoever that is managing the diabetes or the dementia. If she's diabetic, somebody will be managing the diabetes. Speak to the doctor and see what they can give. There are topical creams that can be applied, but you know, a lot of it, or what can be applied, would depend on what other medications she's on and what the underlying allergies are. Is running sport considered good for cartilage for those who are approaching 50 years old? Yes, well, there are people who run at all ages, and a lot of it depends on how you run, what shoes you use. Generally, rheumatologists advocate brisk walking or swimming for cardiovascular exercise. On Dr. Koh's comment about 2 hours interval between Chinese herbs and Western medicines, is there a time interval? No, there is no time interval. If you're going to take Chinese medicines and take your Western medicine as well, please tell your Western doctor so that they can look out at your liver function and your kidney function tests to make sure that the combination of medications that you are taking isn't upsetting your body. Glucosamine prescribed by doctors should continue to take since not much benefits. The question is, do you have any benefit? So some people will say, oh, I have to take glucosamine because it actually helps. So a case in point is my own parents. So my father finds that glucosamine is extremely helpful for his knee pain. And since he's having no side effects from it, I asked him to carry on. My mom doesn't really have any benefit from glucosamine, so she doesn't bother. So, you know, if you find that you've taken it for a period of time and it actually genuinely helps, then, and you're not getting any side effects from it, then, and it's not, you know, putting a hole in your wallet, then do continue. You can continue. But if you find that actually take, don't take, no difference also, you know, and it's costing a lot, then the evidence is that it doesn't do very much. Let's see. Someone says, I have thumb pain due to strain. Can I take diclofenac to help? I can't advise on that, unfortunately, because a lot of it depends on where in the thumb, what was the nature of the strain, and you know, whether or not you have any other health problems that preclude to your taking diclofenac. Yeah. If you take calcium supplements, must you also take vitamin K for better calcium absorption? Yes, some people, there is evidence that vitamin K2 is better for calcium absorption, but we don't usually advocate across the board, mainly because certain people on certain medications cannot take vitamin K because it interferes with those other medications. What causes lower back pain? Any number of things can cause lower back pain. So lower back pain may be coming from all the things that I talked about earlier, can be coming from the muscle, it can be coming from skin, it can be coming from the discs, the nerves, the blood vessels, it can be coming from the internal organs. So if you have low back pain that is waking you up at night, that doesn't seem to be getting better, that is really taking over your life, if you have other symptoms like weight loss or fever or funny rashes come out anywhere or problems passing urine and such, must go see doctor, okay, because it could be anything. What are the causes of referred pain? Okay, so referred pain is pain that you feel in another place away from the site of the injury. And it's not just that it's common in Singapore, it can happen the world over. It's because of the way the human body is. So what this lady is referring to is problem in the hip, and my hip is worn out, but I feel the pain in my knee. And the reason for that is because the nerves, the 神经线 that goes from the hip goes down to the knee. So you know how you see some people when they have heart attack, they don't feel the pain here on the chest, they feel the pain in the shoulder and the arm or the jaw, okay? So that is referred pain as well. So you know, the heart is not here, but the heart shares the same nerves as the shoulder. So that is a form of referred pain, yeah? So for example, with, it's all got to do with nerves. The pain that I had, because of the nerve being compressed, the nerve is compressed up here, but I feel the funny feelings down here because this is where the nerve goes to. Very bad pain in both legs. Do you have to see a GP first? Yes, you would have to see either a polyclinic or a GP because they will be able to do some preliminary investigations and decide where you go, because leg pain, like any other joint pain, can come from either the joints or the bones or the muscles or the blood vessels. So the GP will be able to decide what is going on and route you accordingly, okay? Pentoflex, I'm not sure what that is. I really don't know what that is. That's one that I haven't heard of before. So it says here, when having bad knee pain, can still go exercise like slow run or brisk walk, even when feeling the pain. So I would say, listen to your body. If you're having very bad discomfort, don't go and aggravate the area even more. You know, do it to the level where if you feel that the discomfort is getting too much, then do cut back. So how many grams of sugar can we take a day? 24 for women and 36 for men. And this is in total, okay? So all your meals. What is the correct posture when walking up a slope? I'm not sure I know exactly what you mean. It would be basically anytime you are walking, to keep your neck straight and shoulders back. My mom lost a lot of knee cartilage. Can she have seen this repeatedly as she doesn't want to go for surgery? This one you have to go and see your doctor, your orthopedic doctor or your rheumatologist and discuss it, because very hard to tell, give general advice. This is a general forum, so it's very, very hard to say, because different situations and different sorts of X-ray appearances, different patients with different other illnesses will have different responses. Is curcumin useful for joint pain? Curcumin is the active ingredient in turmeric that is said to have a use in reduction of inflammation. I would caution the use of curcumin that comes in capsules, mainly because people think, again, that curcumin is pretty harmless, and so take high concentration curcumin. And I have seen people have abnormal liver function tests from that. There is some evidence that curcumin may be, the active ingredient may be useful for modulating the immune system, but not enough is known about what the therapeutic level is, the size of the effect, and because curcumin preparations, there is no regulation in how different companies prepare the curcumin. You cannot translate one manufacturer from to another, and different manufacturers may have different levels of the ingredient inside. There may be different fillers inside or different other added ingredients, which may then affect things. So if you want to take any supplement at all, curcumin included, please mention it to your doctor so that they can be prepared to check your liver function test sometime after you've started taking it. This goes for other things like green tea and all that as well, yeah? So green tea extract, green tea supplements also can cause abnormal liver function tests, okay? In fact, I think there was a case of some celebrities ending up with liver failure, right, several years ago, from taking some slimming herb that contained green tea. So yeah, so don't anyhow play is what I would say, okay? Is sleeping on a firm mattress better for the spine and joint? Insofar as it keeps the alignment of that area, if you keep it aligned, and to stop your spine from being like this, if the mattress is very saggy, you will have a tendency to do that when you lie down, and that may give you worse backache if that's the case. Okay. Knee pain, should see a pain doc or orthopedic. See your GP first, and your GP will decide where you need to go. What are the treatment options for referred pain? Depends on what the cause of the referred pain is. So, you know, if it is pain referred from the back because of a trapped nerve, then see what options there may be. There may be options for either things like, so once you've gone through physiotherapy, injections, oral medications, there are other things that pain doctors can do if it gets severe. So that referred pain itself depends on where it's referred from and for what. Yeah, so from hip to knee, if it's your hip that's worn out and you get a lot of knee pain from a worn out hip, then, you know, one of the options would be to replace your hip, for example. The pain in itself is not harmful. It's just your body telling you that, hey, there's a problem here. Okay, it's an early warning system. It's a fire alarm. Hey, this is where the problem is. You know, yeah. Okay. Is breathlessness, thumb, mild numbness are required to see a GP? Well, breathlessness is required to see a GP. Not sure whether the thumb mild numbness is related or not, but breathlessness is definitely a reason to see a GP. Let me see. I'm just scrolling back to see what other questions I might have missed. Overuse injury. What happens if you overstretch your hand and pain already few weeks? Has it passed? If it's not passed, and if you're worried, then yes, you will need to see a doctor. How to treat a shoulder rotator cuff tendon that is swollen? This one, it depends on the reasons why the rotator cuff tendon is swollen and whether you have any other illness underlying it that is causing the tendon to be swollen. If you do not have any underlying reason, then there are several ways. Usually the way would be to get a physiotherapist to see you, to teach you exercises to strengthen certain other muscles, and to take medicines if you are allowed to reduce some of the pain and inflammation. Some doctors will do injections into the area as well, but this has not been shown to be more effective than physiotherapy. If you have another illness underlying this, so for example, if you have another condition that is causing your rotator cuff tendon to be inflamed, then treatment of that underlying condition would be needed. me see. Okay, what most harmful sugar? Sugar is all the same. Okay, the substitutes like xylitol, maltitol are not absorbed. But if you take too much xylitol and maltitol, do you know what will happen? You'll get diarrhea because it is not absorbed. So it tastes sweet, but it's not absorbed. So some people will like to eat those sugar-free sweets, and then after that will run to the toilet because they have a lot of, they have diarrhea. Okay, so I think the thing is to say is that for most of us who live in this part of the world, we need to re-educate our taste buds. And I had to go through that process some years ago too. When I discovered that my cholesterol rose a lot because I was drinking 3-in-1 coffee. And so when I went cold turkey and didn't take any more 3-in-1 coffee, coffee seemed very bland, but it doesn't anymore. And I have learned to appreciate the taste of the coffee for what it is. Rather than have the sweetness on top of that. So now even mild amounts of sugar, it will make me feel that whatever it is that I'm eating is not nice because I'm very used to not having it already. So it's a case of re-educating the brain and the body to a different normal. The way we adapt to wearing masks and tracing together everywhere. So that's also adaptation. Yeah. What causes buttock pain when sitting? A lot of it again depends. So like lower back pain, the buttock area, there are lots of nerves. There are also there are lots of nerves. There are muscles. There are joints. There are tendons. There's also your 大肠, your large intestine, and the pelvic organs. So some people feel buttock pain, but which may be coming from the nerves, maybe, but it's hard to tell. So there's not one cause, there's many causes. Somebody's asked about stevia. So stevia is a plant that gives a sweet taste. So there's no sugar in stevia. But if I'm not mistaken, I think excess consumption of stevia, well, excess consumption of anything is no good. I have to check this up, but I believe that excess consumption of stevia may also interfere with liver function tests, if I'm not mistaken. I'm not sure about that. But it wouldn't surprise me. I would like to end by saying that the basics are actually what we all need. So the basics are enough sleep, good nutrition, moderate exercise, stress management. This is the foundation on which health is built, but it's something that we all do poorly. We only want quick fix, the McDonald's. Okay, so it's time to go slow food again.